Hi, how's it going? Using the microphone here. Don't mind me. Hey, my name is Carlos St. Just, licensed acupuncturist, holistic healthcare provider, and recording this video because it's one of my intentions to put more videos out there. Sometimes I don't like recording videos because I may stumble or fumble on my words, and you're trying to get across this idea of perfection, and that's not the case here. So, buckle up real quick. Another problem I stumble across is that, we sometimes think we don't have anything to say. I'm always telling myself, I don't have anything to say. What am I going to say on the video? And part of that is because I'm a healthcare provider, I always want to make sure everything that I'm telling patients or any information that I'm giving out there is as accurate as possible, with as much evidence, as much research, as much knowledge behind that answer as possible. So with that, forgive me if if I don't cover all topics, or if sometimes I seem a little limited in terms of some of the areas that I cover because of that exact reason. So you can always send me an email, or if you want to come into the clinic here, you can do that as well. And just to give you a little bit more about my background, I've been in practice for going on over 8 years now. And my background is in traditional Chinese medicine, and that encompasses acupuncture, acupressure, and a couple other modalities, cupping, breathing techniques, Tai Chi, Qigong. I'm a martial arts practitioner as well. I've been studying the martial arts for well over 13 years now. Once again, primarily in Chinese martial arts, Kung Fu, Tai Chi, but also I've studied some of the ground stuff, the Brazilian Jiu-Jitsu and submission, grappling, and that's not my area of expertise. It's something that I've trained over the years and tried to incorporate. But ultimately, I try to be a proponent of being at your best. I think sometimes we try to compare ourselves, like in the society, it's like, it's either you're a professional athlete or you're nothing, right? Or you make it to the top, or that's it. And I don't believe that. I think everybody can be their own athlete, and doesn't mean even if you're not getting paid the big bucks, right? I know that's the main thing, right? Even in health, right? Healthcare, a lot of people forego their health concerns because of money or whatever the case may be. That we won't touch on today, but I think everybody has the power to be as strong as they can and push themselves. And I'm reading this very cool book. It's called The Telltale. Hopefully you can see here. The Telltale Brain. The Telltale Brain. And it's just a story of our. It's written by a neuroscientist. So it's just the story of how our brain developed, right? Neurobrain development. So very fascinating stuff. I want to get out there, as a lot of people sometimes assume that just because you're on the holistic side means that you don't have any kind of science background or education or anything like that, and that's on the complete opposite. As acupuncturists, we have to be well versed in our anatomy and physiology, and it's pounded into us, and we have to really learn general pathology and systemic pathology, and then it's re-emphasized in clinical science classes. So there is a lot of in medical research and all the other fun stuff. So there is a big component of the biosciences in my education. And sometimes I might refer to myself as a holistic healthcare practitioner. That just entails my personal journey in incorporating and learning about other modalities and therapies outside of traditional Chinese medicine, right? So, with that, welcome. Today, I just wanted to speak a little bit about getting on that health cycle, a question I get often is, what is acupuncture used for? And I recorded a podcast recently, and just in terms of, I think it has some relevance because right now, if we're timing this, if we're dating this, right now, there's the COVID-19 virus, right? That's the novel coronavirus or SARS coronavirus, or however they're categorizing and naming this disease, right, or this virus. Really, it's very unfortunate, right? There's a lot of people who are sick, a lot of people who are dying from this, and it calls into question what can we do as practitioners, as human beings. I know there's a lot of research going into the genome sequence, and there's a lot of the race is on in terms of the biological studies and research, right? That's going into trying to develop a vaccine or a cure or something, right, to defeat this. What also a lot of people don't understand, or maybe don't know, is that in China, right, where the virus had originated, right, and is currently, unfortunately, doing the most devastation. During the SARS outbreak, you hear the news about the outbreak, you hear the news about the people the number of deaths, but you didn't hear the news about the number of people who were saved and the other modalities that were used. And in China, they do use traditional Chinese medicine. It's a little bit more integrated within the system there. But even to point out some clarifications, it's not it's not the save the day medicine. Even in traditional Chinese medicine, you look at every individual is different. So the flu or any kind of pathogen is going to affect someone. Maybe they all may show very similar symptoms, but there's going to be slight variations in their outcome and in terms of how their symptoms manifest, right? There's some people who don't show symptoms, but it can still shed the virus, right? So it really depends on the person, the constitution. When you get sick, it's really, especially with a virus like this, I had recorded on the podcast, I said, there's kinds of viruses, there's kinds of pathogens that your body, you get sick because your body's just weak, right, in terms of the immune function. And there's pathogens that just kind of override everything, right? Just blow you out of the water, right? There's nothing you can do, right? So best thing to do is, and according to the CDC, the treatment guidelines were to treat the symptoms. And another thing I want to point out is that even as acupuncturists here, you'll never hear me use the word cure. Right, I've been taught and trained, and we don't use the word cure because we don't cure it. We're not curing the disease. I don't want to say we don't cure anything. We're treating things, right? So, and that word cure, it's kind of funny because they don't want to use it for acupuncture, even though there's substantial evidence in certain things that it can help treat low back pain, or it can help with significant relief, and if something goes away, it's cured. Right, but we don't. I don't want to get into the politics of wording and things of that nature. So we say we treat ailments, and there's things we can treat, and there's certain things we can't treat. Someone has a pneumonia, something we already refer out. That's not something we treat as acupuncturists. That's something I refer out to. So I don't have any. Yes, there are certain herbs and protocols I know, right, in the background that can help, but in this day and age, you do what's best for the patient. And if using acupuncture and traditional Chinese medicine and herbs are best, like what they are in a lot of first line issues, that's why, to avoid this opioid problem, we could have used these therapies and put more emphasis on these therapies. So I'm talking on the microphone here. I keep thinking this is like a podcast, right? There's a place for everything in terms of how the medicine what's going to work best for someone, whether it's herbs or pharmaceuticals or surgery or exercise or nutrition or meditation, whatever the case may be, right? We're trying to avoid the more serious stuff, right? The more serious therapies. And so, so with all of this in mind and what's going on and everything, I think it's still, it points to the fact that you need to be at your tip top. You need to be as well informed and as well taken care of your body as possible. And so that's where acupuncture definitely can come in terms of helping boost immune function, in terms of helping you to make sure that your body is as strong as possible. It's not a guarantee, right? So nothing is guaranteed, right? But you can significantly increase your chances in terms of keeping yourself healthy. Seeing patients, I a lot of times when patients come through, right, whenever there's an issue, it's it's my job to see what's going on, document what's going on, and then try to figure out how I can help, right? And trying to get yourself into the cycle. Getting yourself into the cycle means just, seeing where you're at. You can always visit an acupuncturist. They'll give you an assessment in terms of where your tongue and your pulse. I was just telling the patient earlier, a lot of things can happen in 24 hours, right? So, something, you get treatment, you work on your back, and then next thing you know, something happens and you're running around and you've been so stressed out and put your body through so many different demanding environments, and then you wonder, like, maybe 24, 48, 72 hours later, what's going on? Why aren't you feeling better, or whatever the case may be. So, and it's not to always say that it's on the patient or on you or whatever the case may be. It's more it's more just crossing your T's and dotting your I's and making sure we're covering all of our bases here. So I hope this video finds you well. I'm going to end it here, but I promise I'm going to put up more videos. We're going to upload more presentations. If you want to see more presentations, feel free to leave a leave a comment below here. Right? You can rate this video as well, as you're more than welcome to. Any likes would be appreciated. Go ahead and hit that like button, and don't forget to subscribe to the channel if you want to learn more about acupuncture and a more holistic approach to taking care of your health concerns. This is Carlos St. Just, licensed acupuncturist, wishing you to have a great day.